Hello, Leesburg. If you're in need of physical therapy, innovative physical therapy, then look no further than Wim Vergauwen's PHYSIO MED, located right here in Leesburg. Now, we had the opportunity to go in, speak to one of his patients, and also had the honor to talk to Wim himself, not only about his career in this field, but also some really cool art-inspired pieces that he creates here in his office. Let's check it out.
My name is Wim Vergauwen. I'm a master in physical therapy and a certified manual therapist here in Leesburg, Florida. And I'm specializing in hands-on manual therapy, especially with the spine and related injuries. I've been a physical therapist for 30 years and I love my work. Don't like the paperwork that much, but I love my work with patients. And it's always a good thing if you can make someone that's been through problems even for 10 years, you can make them feel better after like 4 or 5 weeks just working on the right thing. Because we hear a lot, they tried pain management, other therapy, and things didn't help that much. And we see pretty good quickly results, so that's always motivating too.
I was diagnosed with peripheral neuropathy. I have it in my hands and my feet. When you have this kind of neuropathy, it's hard to stand for longer than a few minutes. You know, that's why you have to build and work your core. So I had to learn to get stronger by coming here. Wim taught me many things to keep my core strong. He worked on my back, manipulated my spine, gave me exercises to do, strengthening mostly, some stretching. And when I did get that diagnosis of the peripheral neuropathy, it also affected my sciatic nerve. So I had to learn how to deal with that as well.
Well, what I do is what's called manual therapy. Is a specialization within the physical therapy, working more with the spine and all that. And so we hear of a lot of patients coming in, and they come in and say, I've been with my back somewhere else and it didn't do anything. And when you ask, they say, yeah, we were on a bicycle a bit, some exercises, and then they did some electrotherapy and heat and all that. But so we try to go to the cause of the problem. So the evaluation is really very important. So first we want to see where the problem really is. So the evaluation tells you more than anything else. And then we do a lot of hands-on, you know, the muscles. Sometimes you might have a sciatica on the right side. It might be your left joints that are not working right, so you know, and on an X-ray you can't see it because you don't see movements. So we try to work more manually and then very specific exercise and all that compared with traditional therapy. There's very little hands-on these days, you know, artificial intelligence taking over, so it's more machines than the hands, but nothing replaces the hands.
Why is using your hands so important to the healing process, so important to the process of what you do here?
They did a big study where they found out for back problems specifically, because you have 24 vertebrae, every vertebrae has about 6 to 10 joints, you know, so you don't see movement on an X-ray or an MRI. So they said there's only a very small percentage related. Like if you're over 50 years old, you're going to have these problems, you're going to have degeneration, you're going to have some things going on in the spine. I always say my hair doesn't look the same. I was 20 years old, you know, so it's a normal thing. It looks different, but it doesn't mean it does give you problems. Like the relation between what you see in the picture and the real problem is very little, because you don't see movement. So what we do with the movement, we can see what is moving and what is not moving. And actually, the things that are moving too much are sometimes the most painful one, and the ones that look good on the picture are very often the bad ones because they don't move. So that's what makes the difference a little bit. Go to the cause of the problem. So the neck, you know, if you feel a bit tight in there, so you know, so the tightness of the neck. A lot of times, you know, when you sit on a computer or a phone, your head is forwards a little bit. So again, your upper back is really important. So try to work on your posture a little bit. Sit in a good straight chair, not too much in a soft chair or recline. So I'm just going to check the movements in your neck a little bit. So every vertebrae should move a little bit. Problem is the middle neck works too much usually because the lower part is not working enough. So I'm just going to go a little bit more underneath the lower part. So every vertebrae should move a little bit. So we try to move one vertebrae at a time, so that's important. We don't want to do any quick movements, you know, no twisting quickly, so just kind of one vertebrae at a time, so we can loosen up the stiff ones and other ones we don't want to move. So very often the middle neck moves too much. Everyone sits a little bit slouched and everything moves too much in one area. So ideally, you should move like 10 vertebrae down, all the way from your top of the head towards your lower part of your neck. So 10 vertebrae should be moving there.
I've been working on that.
Okay.
My side to side is much better.
Good. Yeah. That's important.
What's your goal overall for every patient that walks in here and then also leaves?
Well, my goal is always, it's a pretty active community. It's a little bit an older community, but it's an active community. So we want to get them back to where they were before. If they're a pickleball player, it's very good for our business because there's a lot of injuries with it. You want to get them back to pickleball and do it a safe way. Sometimes it might be a weakness in the hip that caused the problem, just over and over repetitive movements. Or a golf player, you want to get them back to golf. So my goal is to get them always back to where they were and maybe a little bit better even. So.
When did you realize that it was responding to your body, that Wim's approach was responding to your body?
I had danced for many years, and it enabled me to continue doing that. And I have taught in this area in my retirement community for 25 years, and previously at studios with children. And he's helped me to be able to continue doing that. I always feel good when he's manipulated my spine or worked on my IT band. I always feel better. It makes me feel good. And I'm able to do a lot of things. Go shopping, drive, take care of the house. I can bend down certain ways, because he's taught me that too. And he's a great therapist. Like I said, he's helped me tremendously. And we work out over here, especially if I'm having a problem. And with neuropathy, you can have issues on and off, and sometimes you can't do it yourself. So you go to your therapist, one that you trust and have confidence in, which I do,
All right. So you feel good? Yes. Relax? Mm-hmm. All right. All healed. All right.
Your art is very nature inspired. How did that all begin? What's the backstory to the art, and how does that play into part of the healing process?
Well, I started actually with more the sports figures, because in the gym I wanted to have posters of sports figures and I couldn't find the right posters. So I got a book of the best 100 athletes in the last 100 years, and Carl Lewis was in there, and Mary Lou Retton, and all. We lost some in a fire. But I just got a piece of plywood, 4x8 and cutting 2x4s and painted the sports figure. You can see over there too, but then that was just for the gym, and then I just love traveling. I love nature, and there's nothing like being in the middle of a rainforest and see like a couple of hummingbirds fighting for a flower, or swim with the manatees. So whenever I swim with the manatees, I have to paint manatees, So it's just kind of, I was brought up in an area. My dad had a lot of animals and all that. So and plus I love traveling. So. Yeah.
Your mother was a very well-known artist in Belgium. And some of her pieces have inspired you and such. Tell us a little bit about that.
Yeah, my mom, I only started doing artwork when I was here, when you start your own business, and I want some things on the wall. And like always, something you live in every day, you don't appreciate it as much, So I learned a lot more from my mom. But she was mostly like she did a lot of painting too, but also a lot of sculptures. Like there's a couple little ones, because the big ones are too heavy to bring over from Belgium. But yeah, she was a great artist, and I would love to do sculpting, but the painting too. I wish I learned a lot more from her. She passed away a couple of years ago. But it's like I said, it's the things you learn, you live every day with. You don't always appreciate it, So, but yeah.
I just want to thank you, Wim. It was such a big help. My IT band feels really great.
No problem. Good. Okay, see you next time.
Okay.
Thank you so much to Wim and his team and Linda for speaking to us this afternoon. If you want more information, please look at the link below to see how you yourself could sign up and have an appointment with Wim. Until next time, I'm Ken with LakeFront TV. We'll see you soon.